Hello. I feel like I look shorter than normal.
I feel like he looked appropriately short.
Okay, but I look shorter than I normally look on camera, is what I mean. Because you're in a different chair.
You're still pretty, though.
I didn't say I was ugly. What's up, guys? Welcome back. How many days has it been since I went live?
I don't know. How many days has it
The
been?
baby shower, I think, is the last time I was on YouTube. Woo!
Hey, everyone. How's it going?
Bonnie is not here yet. I know there are some of you hoping that's what this...
But she is here, but
Okay, she's not out.
still
She's
internal.
out. My water hasn't broke, nothing like that. We just wanted to kind of give you a little bit of a life update and then answer some pregnancy myth questions that we get all the time.
Yeah.
And also talk about some books I recommend for anyone, really. It's just good information if you have a daughter, a granddaughter that's soon to have a baby, if you're soon to have a baby, or you just like learning. Honestly, these are really good books that I'm going to suggest to you guys. If I huff and puff, I am having contractions, but it's prodromal labor, not active labor, which is basically like the warm-up. This could go on for weeks, or I could have my water break tonight, you know? Who knows? Only Atahala knows. You know what that's off of?
No.
Why are you reading? So he's over here reading something. What are you reading?
I'm being prepared.
So if you guys have any questions, go ahead and ask them in the comments, and we'll answer as many as possible. We had our 37-week appointment. Is that yesterday?
Yeah.
Yesterday. Yeah, yesterday. I have NSTs done because I'm 36 years old. And they just do that to cover their butts, essentially. Nothing really matters on my end. Like, I'm perfectly healthy. They're just doing it to cover their butts. And then we went and ate at one of our favorite restaurants that we haven't eaten in a long time called Urban Grub. And they have a raw bar. It's like sushi bar and stuff, and charcuterie board and stuff like that. I posted a picture of me eating these raw oysters, which I ate 2 dozen of, by the way. And I guess we have new people following me because, as most of you know, I ate raw oysters with Beckett as well.
How many dozen raw oysters you think you ate while you were pregnant with Beckett?
With just Beckett.
Just Beckett.
High 20s.
Yeah, 20 to 30 dozen.
Probably less with Bonnie, but that's because we don't go as many places. We don't live in Nashville. We're not traveling as much. And so I don't have access to them. When I was pregnant with Beckett, we went all kinds of places. We even went to New London and New Mystic, and like the areas where oysters are right there, you know. So I was eating them all the time. Anyways, people really got worked up.
Yeah, you were eating processed meat and raw seafood.
Deli meat, raw cheeses, and raw seafood.
Yeah.
Yeah. If you're new here, hi, my name is Neisha. I'm a registered nurse, former labor and delivery nurse. This is my husband. I'm a family physician. But people still feel the need to tell me that I don't need to eat things like that.
You shouldn't eat that. One lady said,
I'm an RN.
I'm an RN. You shouldn't eat that.
I was like, I'm an RN and I'm eating it. So see how much that RN means, don't we?
Yeah.
But
so I pulled up.
Okay.
I pulled up the ACOG guidelines for their official dietary recommendations for pregnant women, and there are a number of fish. Saltwater fish, seafood that they recommend you avoid, but it's only because of the high mercury content. Yeah. And this doesn't mean you can't have one serving of this during your pregnancy. This means you don't need to eat these repetitively during your pregnancy.
Most people don't even have access to these type of
right.
fish.
And so here's the list: big eye tuna. I don't even know what that is. King mackerel, marlin, orange roughy, shark, swordfish, or tilefish.
And albacore.
And then limit white albacore tuna to only 6 ounces a week.
Mm-hmm.
So you can absolutely have a serving of those once during your pregnancy. It's no big deal at all. So all these fish are kind of the top of the food chain, top of the food pyramid, guys. They eat everybody else. And so the mercury accumulates and concentrates into them. So their meat can be way higher in mercury. But the tiny fish and then oysters and stuff like that, there's no meaningful mercury buildup in those things at all.
And then on the raw fish part, it's mostly like the risk of you getting food poisoning.
Mm-hmm.
Poorly handled food in general is not good for anybody, and especially, you just don't want that when you're pregnant anyway. So
you don't recommend getting a dozen raw oysters from the gas
from
station?
Hooters.
Or from Hooters or from the convenience store.
Right. It needs to be a reputable place that sources their seafood daily, which is where we go. Not just some random place that offers blue points and who knows how long they've been sitting in the kitchen. And I'm not saying go crazy and eat whatever. Like, be responsible, be smart, and understand that it has more to do with quality and the freshness and how the food is handled than the actual rawness of the food. And sashimi grade, same thing. It needs to be sashimi grade fish. You don't just go to the Walmart, buy salmon, and eat it raw. You don't do that.
Yeah. Think for a moment how many foodborne illness infections occur from salad, which is also raw.
Yes.
You forget that all the stuff in salad is raw. And how many times do you read a news article, this big salad blend recalled for E. coli? So you don't want a pregnant woman to have a huge bacterial infection while she's pregnant. That's bad. But if you're really worried about the danger of getting a bacterial infection from eating raw food, you should 100% not eat any salad whatsoever or any raw vegetables that you bought at the grocery store, because your risk of developing an infection are much higher from that than from raw.
A salad bar is what I equivalent.
Oh.
Like saying that I should eat oysters, well, you should not eat anything off of a salad bar.
100%.
Because who knows what is in that salad bar, buffet, whatever. Like, it is, like I said, quality and freshness and how the food is handled. That's the most important thing.
100%. And then obviously you're going to use all of your God-given senses. If the oyster don't smell right or if it don't taste right, you're going to spit it out. Don't eat that, of course.
And I have before. If I thought, oh, that don't taste right, that tastes off, then I won't eat it. I will smell it. Like, I'm very aware. Do your own research. I'm not telling you to go eat raw oysters if you think that is going to give you a parasite. I can just tell you, I have eaten over 40 dozen raw oysters during pregnancies.
Yeah.
I have
How many of you guys have gotten food poisoning from eating salad or raw vegetables in the past? I want you to put in the comments. And then if anybody's ever gotten a foodborne illness from eating raw sashimi or oysters, put that in the comments too. But I predict way more of you guys have had bubble guts or the pukes from eating salad or off a salad bar than you have from eating well-handled raw seafood.
Also, there are many cultures where raw fish is an everyday occurrence, and it is not only fine, it is encouraged because. So I'm going to show you another book. Let's see. Oh, I haven't showed you any books yet. Here's the first book I'm going to show you. This is called Real Food Pregnancy. It's by Lily Nichols. It's on Amazon. You can find it on my Amazon shop page, which is amazon.com/shop/Neisha Loves It. So in this book, she goes into a lot of detail about a lot of things. But when it comes to foods to avoid, she says avoid raw fish. But she also says do your own research and understand the risks versus benefits versus what are the chances of you actually getting sick from eating this highly nutritious food that is most doctors tell you to avoid. So, for instance, let's say oysters are highly nutritious and you can have them cooked. If you're scared to eat them raw, then eat them cooked. Are you going to tell me what's good in oysters?
Oh my God, the list is too long. It would take 3 hours. So iodine, zinc, omega-3 fatty acids, the list of vitamins and minerals in oysters or mussels or any shellfish is just off the charts. They are a literal superfood. It's like taking a multivitamin when she eats a dozen raw oysters. Not just a multivitamin, because 90% of the vitamins and minerals in a multivitamin you crap out in the toilet because they're not absorbable. But she's actually has access to all the minerals and vitamins in those raw oysters, and she absorbs them immediately and shares them with Bonnie Blue. And that's what that's what food is, right? That's the definition of food. It gives you nourishment.
Yeah. There are so many places around the world where pregnant women are eating raw food.
Well, you read something in Japan, that's like a pregnancy food. Yeah. You have sashimi every day of your pregnancy. That's raw fish. Yeah. And of course, they're not going to pick it up off the side of the road. Yeah. It's well handled. Yeah. It's refrigerated. It's taken care of. Yeah. Yeah.
Also, I think the area of where oysters come from seems to matter. So we never eat from the Gulf.
Yeah.
We don't eat oysters from the Gulf. We eat them from Massachusetts, Maine, New England, Maine,
East
New
Coast,
England, East Upper Coast, cold waters. Yeah. I've never had a bad oyster. Even when I'm not pregnant, if we have blue points, I usually am like, these are not good. Yeah. So I think
is that all they have in the Gulf is blue point?
I think there's other ones too, but they don't. They're just not as good. They tend to have a more fishy taste to them. They're not as fresh and salty and briny. But yeah, here's another really good resource for you mamas, grandmamas, mamas to be. It's called Expecting Better by Emily Oster. So this book is really interesting in the way that it's written and who it's written by. So this is an economist, which you would be like, why would I take pregnancy advice from an economist? It's not her opinions on things. She takes the data, the evidence-based research, she converts it to numbers, which is what economists do, and she gives you the risks, the pros and the cons in numbers form. Like, is it possible to get toxoplasmosis from kitten litter? It is possible. However, it is more probable that you would get it from gardening and touching garden soil, which no one talks about.
Right.
And so she talks about, like, here are the common things that you get told. Here's the chances of that actually happening to you. And here's what is more commonly or more likely to happen to you. So it's very, very, very interesting information. So don't get discouraged by being like, why would I take advice from an economist? It's not her opinion.
Right.
Now, she does tell you what she did. She got all this information because she was pregnant and she's been told all this stuff. And she was like, I just feel like I need to know more. But why? Okay, you tell me not to do this. Why?
Yes. Which is an excellent question that anyone with any level of intelligence is going to ask. Mm-hmm. You're not going to blindly believe that. And she's a numbers girl. She's a statistician. Yes. And so she knows how to do research and she knows what the results mean. I love that book.
Yeah. So it's a very literal book. So it's not like I feel that kind of thing. It's like, here are the numbers. Here's what you should know. Make your own decision. So she doesn't really try to sway you one way or the other. She's just like, here is more information. Here's what you need to know to make an informed decision so that you can feel good about the decision that you indeed make, which may or may not be to, eat eggs with a runny yolk like I do. I also do that
every day.
Every day. Do we have any questions? Did you see any questions?
Oh, let's see. I've seen a bunch of questions. Is this
oysters in a can compared to sardines in nutrition?
Either way, you cannot lose if you eat oysters in a can or sardines in a can or cod liver in a can. Those all three are superfoods. You win. Congratulations.
Oh, happy Canada Day, by the way.
Hey, happy Canada.
To our Canadian friends. My worst food poisoning ever was Taco Bell. Yeah.
I think I had Taco Bell hell.
I think everyone has had Taco hell. That's what we call it when you get food poisoning from Taco Bell. We call it Taco hell.
Yep. I think I've had that once.
Yeah. We think it would be really cool if Bonnie came on 4th of July. Then we'd have Red, White, and Bonnie Blue birthday parties,
every year.
All right.
Roxana does your raw egg trick in her coffee every day.
It's awesome. All right. Let me see if I can find a good question. Rebecca says, should women in general just eat like that book recommends, even if you're not pregnant? So the Real Food Pregnancy book, I mean, this is a good place to start.
Yeah, it'd be 100 times better than eating the standard American diet or the American Diabetes Association diet.
I don't really know that Lily promotes keto.
It's low carb.
It's low carb, low processed sugar, low processed foods, real whole foods.
Yeah.
But she does, talk about berries and lettuce and fruits and vegetables and stuff like that. It's not carnivore for sure.
Yeah. She probably is a fan of whole wheat, like stone ground whole wheat. I'm not sure.
It's been a minute since I read this one, but I know she does legumes and things that I wouldn't personally eat, but that she does talk about. But it is the closest nutritionally pregnancy based book that I can promote at this time. So I don't really have another one to tell you guys about till I write one, which will be in 100 years.
Kelly says, is it safe for my almost 15-year-old son or daughter to do keto carnivore?
Take it away.
100%. Yeah. So every human on the planet, if you go far enough back in time, they ate a very meat heavy diet. At least 70% of their food came from animal foods, animal flesh. And so I'm talking about 2- and 3-year-old kids when they started to wean from breast milk back then, they ate meat. 100%. Yes. And so if you have a young kid who's finicky, they don't like their vegetables, just let them eat their meat and eggs. They're going to get all the nutrition they need. They're going to get much more nutrition than they would get in a plant-based diet.
Somebody said, I think I saw a question, I don't know where it went, about what the baby will eat besides breast milk.
Yeah.
So, we'll be breastfeeding a breastfed Beckett, no problems, 20 months.
Yeah. For the first 4 to 6 months, depending, she'll eat nothing but breast milk.
Mm-hmm.
She'll have no water. She'll have no fruit juice. She'll have no Gerber rice cereal.
Definitely no rice.
Or puffs. No, none of that crap. That's junk food for infants.
Beckett's first foods were liver, like liver pate, liver mousse, scrambled eggs, avocado, ground beef.
Beef remnants off a beef rib.
Rib bones. He would gnaw on the rib bones and suck the what was left off of them. What else did he have?
Avocado every now and then.
That's mainly.
What other plants? That was
pretty much it.
Avocado
I did
was the only.
introduce him to peanut butter just because we wanted him to not have an allergy, and so exposing them to things like that is the best way. Eggs as well. Our pediatrician actually was like, "Wow, you started on eggs. Most parents are afraid to," and we were like, "Oh no. He's had plenty of eggs."
And also, when he was younger, he loved olives,
boiled eggs,
baby olives, which are capers. He called them baby olives.
He did boiled eggs in the beginning, but we would mostly give him the yolk, not the whites, and he would eat the yolk. And when we made him scrambled egg, it was just the yolk, not the whole egg, just because it's more fatty. We would put cheese and butter in the egg sometimes. I think that was the main foods he started out with. And then after a while, he would have sausage and bacon and steak. He loved steak when he was a baby. Like when he had teeth, by the way. Yeah. He had his first 2 teeth when he was 4 months old.
Yeah. When he had 2 tops and 2 bottoms, he would wear the little bites of steak out.
Well, I would chew them up for him.
Yeah. Which is very ancestrally appropriate. And also, if any of you guys have been around babies with no teeth, they can bite the crap out of you with their little gums. Their little gums are hard. They can smush up lots of things with their gums, even if they don't have teeth yet.
Yeah. But I would get a lot of looks at restaurants when I was eating steak because I would chew up some, pull it out, and give it to Becca, and people were like, "What the hell?
Yep.
Is she?"
Yep. And that's
feeding the baby.
Yes, exactly. And that's a very ancestrally appropriate way. Instead of putting it in the blender and wasting electricity, just chew it up and kiss it into your baby's mouth, or take it out and put it in their mouth. That's very, very appropriate. Teresa's watching from Slovakia.
Wow.
Welcome, Teresa.
Beckett does not like oysters. He loves shrimp.
Yep. Shrimp and scallops.
He won't try an oyster. He wants to play with the shells.
Yep.
And that's about it. Yeah.
They look a little too gross. I get it. I was older before I would eat them. Even my teenage years, I would have been like, I'll do it for a dare, but I'm not going to eat them.
I didn't eat them till I was with you.
Yeah.
I was like, no thanks.
Yeah. Elena says her only food poisoning ever was from a McDonald's snack wrap.
Oh.
Yeah. And so, what if, based on just Elena's experience, we said, oh, no pregnant woman should eat a McDonald's snack wrap, which I think is probably true.
It's true.
Right. But you can't, and so that's how rare it is that a pregnant woman has a complication because of raw oysters or sashimi. It's unheard of. Maybe one case a year. So it's ridiculous.
Yeah. So I've just weighed my risks and benefits, and I found the risks to be quite low and the benefits to be quite high, and that's why I partake in raw oysters quite frequently.
Exactly.
Millie says my 5-year-old eats crabs with lots of butter.
Beckett likes crab meat.
Yep. He mostly likes to play with the crab legs.
Oh, he loves the claw. Yeah, he loves the claw.
That's what he loves to do. I love how easy Carnivore is. I've been 8 days in and I feel amazing.
Excellent.
Good job, Teresa. I had food poisoning for KFC. I feel like most of these food poisonings are from.
So we're seeing salad and fast food restaurants. That's where people get food poisoning from. So maybe pregnant women should avoid salads
and fast food.
And fast food restaurants. That's probably much better advice. And also, if they avoided the fast food restaurants, they would have a much lower incidence of gestational diabetes.
Probably.
Yeah.
My dad is bringing me chicken liver for lunch. Melina, how long fasting until I'm in ketosis? I messed up the last few days. I'm having trouble to find my way again.
Yeah, it just depends on the person. Anywhere from 16 hours to 3 days. But you're not going to go wrong with fasting. Just keep it up. Keep eating very low carb when you break your fast, and all good things shall come to you.
How's our Bonnie Blue doing today? She is crazy as usual.
Are you going to do a bump update on your channel?
I feel like y'all probably just saw this.
Your people need to see your bump.
This shirt is awesome, by the way. I can't believe it still fits me. Look at that. That is a big bump. Pedro!
Come say hi to everybody.
Who's everybody?
900 people.
900 people.
Only 900 people, yeah.
No,
hello.
Here.
Oh, hello.
Come between us.
Hello. How are you?
Thank
there
you.
You go.
Thank you.
Excellent.
Okay. Sit down.
It's on the table at the barn.
At the barn?
Yep.
Okay.
Yeah, he's the superstar.
Pedro's the turkey whisperer.
Yep, that's the baby's name. I feel like most people know that, but there's still a few of you who don't watch every single thing, and so it's still a surprise. But yeah.
Yep.
Bonnie Blue, she has another name too, but we won't announce that until she's born.
Yeah. Now, are all of you, we're on Neisha's channel, not mine. Have you guys all subscribed to Neisha's channel? Because I posted this link, and I think some people may think they're on my channel. Oh,
really? Oh.
Yeah. So if you're not subscribed, click that subscribe button and the little bell notification button. Because when Neisha goes live, you're going to want to hear what she has to say.
Bonnie Blueberry Esquire.
That's right. That's right. That's right. Or MD or PhD.
We have 2 lawyers in the family already. How many doctors do we have?
1.
No, 2. Sarah married.
Oh, yeah. That's true.
So technically 2 doctors.
Yep.
How many nurses?
A bunch. Several.
Me. Basically everybody on my dad's side.
Yeah.
is a nurse. Excelsior.
Yeah, you should do a whole show with just Pedro.
I know.
Bev is exactly right. Pedro is hilarious.
Yes, he doesn't even try to be hilarious. He just
Yeah, it's natural. He can't help it.
Maybe she'll be dramatic. Ashley, we know she's going to be dramatic. There's no maybe. There's no maybe.
She's going to get that from her mother.
Yeah, he came to deliver me food. Poppy does that quite a bit. How many times have you went and got me food?
Several times.
Twice.
How many times have I set it up so that you had food delivered?
I don't know if that counts.
I feel like it does, right?
If he doesn't go and get in the car and leave, does that count?
I don't actually have to go get it as long as I
If he calls my dad and says, Neisha wants blah, blah, blah.
If I make it happen, if I facilitate it, I get credit, right?
Yes,
be kind to your husband.
It does count.
That's right.
It counts?
Yes.
I don't know. I feel like other husbands have to get up out of bed and go get it. And he's over here got a good father-in-law. He's
use
not
it.
instant carting it, okay? He's calling my dad.
I make good use of all my resources. That's just a sign of intelligence, right?
Sure. I think Pedro gets the credit, right?
It's
Yeah.
Stacy Lynn. I've never heard that.
Is it poppycock that manicures can create hormonal and endocrine disruption in PCOS? I think it probably depends on
From the chemicals, maybe?
yeah, it depends. I would say it's 1% probably. It probably does have a slight effect just on your estrogens and things like that. I think Anthony J would say there's stuff in there that you should stay away from. However, I don't think giving up manicures is going to do as much for your PCOS as giving up sugar and processed grains and carbs and vegetable oils and that type of thing.
Totally agree. Mimi, I buy my cod liver from Amazon. I get a stack of, I think, 20 tins or 12 tins at a time. And it works out to, they're really cheap per tin. For the nutrition you get, I mean, you can't beat the deal.
Shared credit.
Shared credit.
I agree
That's
with
right.
that, Michelle. I agree with that.
Oh, Nurse Cindy said partial credit. Okay, that's fine, Nurse Cindy. I'll remember you.
Partial credit. It's the same as shared credit. Partial credit.
It doesn't sound as good.
It doesn't sound as good, does it? Barbara wants to know, will doing keto or carnivore help with alopecia?
Maybe. It depends on the cause of your alopecia. If your alopecia is being caused by an autoimmune disorder or from a hormonal imbalance, then quite possibly it could at least slow down the hair loss, if not improve hair regrowth.
Bonnie looks like a 9-pound baby. How much did Beckett weigh? Beckett weighed 7 pounds, 10 ounces. But listen, the size of the belly ain't got nothing to do with the size of the baby, unfortunately. I have seen very large women give birth to teeny tiny babies, and teeny tiny women give birth to 10-pound babies.
Yes.
You just cannot tell. And also on an ultrasound or a BPP, they can give you an estimation. I've seen those be 2 pounds off both ways, up and down. So it's just like, who knows? She could be 6 pounds, 12 ounces. She could be 10 pounds. I don't know. We'll say, God, please don't let her be 10 pounds.
When I was in residency, we'd do BPPs and we would all keep up with what our guesstimate was for the weight to see who was best. And we finally just all gave up. It's like, this is dumb. It's plus or minus 2 pounds.
Yeah. There's just, it's not that good, unfortunately. It'd be great if we could know ahead of time.
Yeah. Somebody asked about beef liver versus cod liver oil. And I would discourage you from taking any extracted oil at all. I would eat cod liver. I would eat beef liver. I would eat any liver, but cod liver oil is by definition at least some degree oxidized and rancid. If you're going to take cod liver oil, get it in a blacked out bottle so no light can get to it. Keep it refrigerated constantly and try to use it up. Buy a smaller container so you can use it up as quickly as possible. But still, it is a weak replacement for just eating cod liver.
I won't be eating cod liver. Calf liver is supposed to be very mild.
Or more mild. I don't know if it's very mild, but yeah.
I've heard very mild.
Oh, really?
Yeah.
We got to try some calf liver.
I'm not going to do that. Not for a long time.
Marianne says, I've had a clogged ear for a few days. Will fasting help? It depends, Marianne, on why you have a clogged ear. If it's infection or inflammation, then definitely fasting will help. If it is from a cerumen impaction or from a foreign body, then it will not help.
I did buy calf liver. Do you know where it is?
In the freezer.
Still.
Yeah. Lovaza, Michael asked, that is a prescription strength fish oil. I'm not a big fan at all. I prescribed it when it first came out. I got a ton of samples and the drug rep really dolled it up for me. And I'm like, yeah, no, I like that. But when I would recheck lipid panels, it barely moved the needle on any of the tests. It's expensive as hell. And think about it. How are you going to get fish oil in a capsule without heating it? It's impossible. You've got to have heat to close the gel cap. So, yeah, Lovaza is no better than just eating cod liver.
Becky, any tips to hide liver and other foods to handle the taste better? Ground beef, period.
Yep. Tell them about our ground beef.
Burgers, meatballs, meatloaf, ground beef with your liver. That's it. And then add spices. You can add, chop up some onion really, really fine, some peppers. My meatloaf recipe, I think, is the best way to hide liver. You just cannot tell it's in there.
Yep. Totally agree.
But hamburgers, same way. You can add it to hamburgers with seasoning and then put your burger in a bowl and add your usual toppings,
Yep.
you know.
And if you're having, I don't know if other people in other parts of the country do this, but we have access to a lot of people who will make like homemade pork sausage. And that's another brilliant way, because with the sage and other spices in that, they can literally put 30% pig liver in that. You will not be able to taste the liver at all.
Yeah, taco bowls, another way. Just literally ground beef and liver, put it together, spice it up. Boom. There you go.
Yep.
Yes, liverwurst. You can eat liverwurst if you like liverwurst. Yep. What's the other thing that you
liver
get?
pate, Braunschweiger, liver loaf,
yeah.
liver cheese, any kind of ground up liver like that, as long as it's not cooked to death or highly processed, it's a superfood multivitamin.
Mm-hmm. Edward says, if you cook grass-fed, grass-finished ground beef, should you drain the grease? Either way, if it's grass-fed or if it's just regular beef, it's just personal preference to drain off the fat.
Yep.
We typically do not, and if we do, we reuse it to cook other things in. I tend to use spices in there, and it soaks up the grease, so you don't waste it. But you're not drinking the fat, because a lot of people are like, I can't, that's too much. And I agree. I don't love beef tallow. But if you put your seasonings in there, like taco seasoning, if you make your own seasoning, it's super, super easy.
Then it becomes a spicy gravy.
Then it soaks. If you let it simmer with the lid on for a few minutes, it soaks into the meat, and so there's less fat in there.
Yes. And you can also add some pork panko, which is ground up pork rinds, and it'll soak up that and make it like a thicker consistency.
No, it's good.
If you just don't want to drink the grease, there's nothing dangerous about the grease. There's no reason to pour it off. That's a holdover from the years when we were told that any fat's bad for you.
Pork panko doesn't absorb quite as good as any like Parmesan. Parmesan's would soak it up better.
Yes.
Pork panko is already greasy. There's not a lot of room for absorbency there because it is already basically fat. You might get the bubble guts if you did that too. So, Maria, I will put the closed caption on after this is over. Unfortunately, we can't do subtitles while we're live.
Yeah, it seems like they should.
So it will have to. I'll come back and do it later though.
Yeah.
Chaz says, any thoughts on taking bentonite clay to help gut flora or other health benefits? So Redmond's has bentonite clay that we use mostly topically.
Yeah. And I've looked, I like the concept of bentonite clay, but I haven't found a lot of research supporting its use for balancing or adjusting the gut bacteria, or with dealing with parasites or any of that stuff. You hear a lot of that stuff out on the interwebs, but I don't find any research to really support that. I know it makes great toothpaste. All of Redmond's toothpaste have bentonite clay. Makes great facial stuff, great skin concoctions and decoctions. What are the other concoctions? Concoction.
Some people have used it as a dry shampoo.
I bet you could do that to absorb the.
I've not done that. I have really dark hair, so dry shampoo and me, just like, we're not the best of friends, and my hair never gets greasy anyway, so it's fine. Yeah. But I do when I if I'm ever going to put something on my face like a mask, I just make my own with the bentonite clay. I have a brand new container in the bathroom right now because I figure once I have this baby and I breastfeed, my hormones are going to start going crazy, and I'll probably have a few breakouts. So,
yeah, and a few breakouts and a few breakdowns.
Absolutely, breakdowns. I have those anyways.
Archangel says, "How do you know if a brand of salt is safe?" There's the best way is to just buy Redmond's real salt, and then you're done. You don't have to worry about anything. But what you don't want is an evaporated salt from the modern ocean. You don't want that. It has nanoplastics and microplastics and Chernobyl and Fukushima fallout in it. You want a mined salt that comes from deep under the ground, that came from an ancient ocean back when the oceans were pristine and clean and not polluted.
Amanda, what other vitamins other than a prenatal would you recommend while nursing on keto? Vitamin D3, absolutely. I think the research shows to take 5,000 international units every other day, 10,000 international units on alternating days.
Yep.
Vitamin K, you can, or what is it? D3 K2
Yep.
combo in MCT oil is what I use. I think that's on my Amazon page too. Iodine.
Yep.
Yeah,
I
what
think
else?
so. Folate, iodine, zinc, omega-3 fatty acids.
Most of these things you can get from your food. If
That's
you're
right,
going
yeah.
like eggs, high in folate,
Yep.
high in
Choline. Eggs are high in choline.
Mean, it's that eggs are a superfood.
They are.
So if you can bring eggs into your diet while you're breastfeeding, that's going to take care of a lot of things.
Yep.
Of course, supplementing, it's not going to hurt a thing.
Yep.
So cover all your bases, especially when you're breastfeeding, because that is literally sucking your breast milk wants the baby to thrive. It's going to pull it from you, just like in pregnancy. Like the baby's going to get better nutrients than you're going to get if you're not eating properly.
Yeah.
Same thing with breastfeeding. That milk is going to suck the nutrients out. So you need to make sure you're getting plenty of vitamin D for you and for baby.
Yep.
A lot of doctors will prescribe you vitamin D drops, which is absolutely necessary if you're formula feeding. But if you're breastfeeding, as long as you are supplementing for you and baby,
yep,
then baby will get vitamin D3.
And the research was done with 6,400 international units of D3 a day. And that's why Neisha said take 5,000 today, 10,000 tomorrow. That's going to give you 7,500. And when you take that much, you actually produce a lot of vitamin D in your breast milk. But if you're deficient in vitamin D, then guess what? There's none in your breast milk.
Right. So that's what we did with Beckett. He never took vitamin D drops. We do put them in his goat milk now because he's not getting it from me anymore. So he gets vitamin, what does he call it? Vitamin D. Vitamin D.
And he doesn't like the taste of it.
I don't want vitamin D. We have to sneak it in.
We have to sneak it in there.
He's like me. He can taste anything.
Yeah.
Hey, Sherry. Thank you.
Hope you're doing better, Sherry.
Yeah. PB mustard. What does it mean if sugar runs in the 90s all day? I have lots of belly fat.
It depends on what your hemoglobin A1C and your C-peptide results are. More than likely, you're either pre-diabetic or type 2 diabetic. So get those two tests checked. Running in the 90s all day is not necessarily bad or pathological. That may be completely normal, but having lots of extra belly fat is definitely not normal. It is very unhealthy for you. So cut the carbs, get your insulin back down to normal, get your A1C down to normal, and the belly fat will start to melt away.
How do you stay healthy? Where did that go? Andrea, what do you do to combat or prevent illness and sickness? Any home remedies? We just do our best to eat properly. During the winter, we do increase like zinc and things of that nature, but mostly we just try to keep our immune system at its highest by not eating things that
we try not
down.
to cripple our immune system by eating inflammatory high carb stuff. And one thing that we do a lot more than most people, we do it so much that it might even freak some of you guys out, is that we regularly expose ourselves to commensal beneficial bacteria.
I was like, what do we do?
Beckett will go outside and play in the dirt for hours. Barefoot in the dirt, no diaper. And I can just see moms cringing like, oh my God, he's going to get some bacteria on his butthole or something. It's like, yeah.
He definitely does get bacteria.
Yes, he is. And that's good. yes, that's a good thing. And so we handle the chickens, the sheep, if we can catch the turkey, we play with them too. We have 2 dogs in the house. And there's actually a study published in JAMA years ago that if a family has 2 or more dogs inside the house, the children are like 40% less likely to have chronic allergic rhinitis because they're exposed to, dogs lick everything. They rub their pecker on everything. There's just bacteria everywhere. And you're like, oh, that's gross. No, that's normal. That's normal. Gross. That's the way it's supposed to be. Having a sterile house is not healthy, not good for you.
Yeah, that's another thing. We don't sterilize things in our house very much. Now, obviously, I will sterilize bottles and breast
Baby
pump
bottles,
parts
sure.
and things like that, because Bonnie is not going to have the immune system that we have and that even
Right.
Beckett has at this point. But on the whole, like our counters get cleaned with Thieves, which is just an essential oil. So it's
Yeah.
not like we don't Clorox things,
Mm-mm.
except for the toilets. Okay,
Yeah.
they get Clorox.
We don't use antimicrobial anything in this house.
No Germax.
Mm-mm. Because if you get rid of all the nice, docile, domesticated, gentle bacteria, guess what you're leaving room for? The mean ones. Yeah.
Vinegar and water. Yeah, that's another great thing to clean with. I just cannot stand it. It gives me PTSD.
Archangel says God made dirt and dirt
Dirt don't
don't hurt.
hurt.
How many times have you heard that?
Kayla used to say that all the time.
Growing up. Yeah.
Also being outside in the sunshine and getting vitamin D that way as well. That is another way to boost your immune system.
Absolutely.
Thank you, Joni and Jean. Thank you guys.
There's more money for the diaper funds.
Yeah. What else do we do? That's pretty much the main things. We just don't over sterilize.
Yeah.
We probably under sterilize. Like if people, even when the virus that shall not be named was around, we were not doing what everybody else was doing.
No. But, Dow Chemicals and Windex and 409, they would all have you believe. They would love to have you believe that you have to keep everything spick and span. Oh, that's a brand name, isn't it? Right? You have to keep everything sterile or you're endangering your family. You're not a good mother. You're not a good wife. You're not a good parent. That's bullshit. Can I say it on your channel?
Yeah, you can.
Okay.
Yeah, I think I cuss more on my channel than you do.
That's total bullshit. They're trying to sell a profit. That doesn't help your health in any way. Neisha does look amazing. Mary McKee said, you look amazing.
How many weeks till Bonnie gets here? Any day now. Any day. I'm 37 weeks currently, so technically, the due date is in 3
weeks.
3 weeks.
Yeah.
But who knows? I'm already dilated. Somebody asked. Yes, I'm
2 to
dilated
3 centimeters.
No, it's a 3 now.
Is it?
You said it was.
Well, a big 2, small 3, something like that. Mid for you labor and delivery folks. She's 2 to 3, 50%. Mid, soft. Yeah, I think there's one more. I didn't check the station.
Posterior.
Yeah, mid. Yeah, it was.
You said posterior.
Yeah, a few days
It was
ago.
anterior.
Keeps moving around, which makes it mid. We're going to take the average.
We're going to average it.
Yeah.
50%, is that what you said?
Yeah.
So that means absolutely nothing, by the way.
It doesn't mean anything. It could be 3 weeks before she goes.
Nothing.
That's right.
Sherry says, we're looking for farmland to purchase in the Midwest. We're first generation farmers. What's the best way to start? Thank you.
With easy animals.
Yeah, chickens. I would say chickens and ducks.
Yep.
Turkey. Quail are
Yep.
pretty easy as well. Yep. And then get on with the Homesteaders Federation and see
Homesteaders
if
of
there's
America.
a get together in your area. Go to those, and that's a great place, first of all, to meet new people that are doing what you're doing and learn the basics.
And I know you're not shy, Sherry, but don't be shy. Go next door to the farm next door and be like, hey, what do you guys grow here? What do you guys do? Farmers freaking love to talk about their crops. They love it. That's what they live for. Ranchers love to talk about their livestock and what they do a little differently and what they raise and what they recommend. And because at each part of the country, it's a little different, what grows better there and what doesn't do so well there. And so talking to the local guys, not only are you going to be making friends and potentially allies in case you need an ally in the future, but you're also going to be learning what really does well at that locality.
I would say, though, depending on how much land you have, if you're going to garden, do raised beds.
Yes.
They're first of all, they're easier. They're everything grows better. The nutrition in your plants is going to be better.
Yep.
The water you're going to conserve water by doing that. There's just a lot of research that shows you should just don't till the land, do raised beds, and then use your land for livestock.
Absolutely.
Sunny says, how does sunlight help jaundice? Is it the vitamin D? So depending on what is causing the jaundice, most commonly, it doesn't even need to be treated, most commonly.
Right. Virtually never does. Is it actually matter?
For breastfed babies.
Yep.
Because breastfed babies are just going to have a little bit of jaundice. Yep. Now, if it's a severe case, then obviously it needs to be treated. However, most cases, it's going to go away within just a few weeks. The main thing to do, yes, vitamin D from the sun, that helps. What helps more? feeding the baby. Just feed,
Yep.
and get it to poop out all that extra
Yep.
bilirubin.
Yep.
Also, any kind of birth injury. So Beckett, last time he was breastfed, and he had a huge bruise from the forceps because he had to be pulled from me. That's going to increase bilirubin levels as well. So he was breastfed and he had that birth injury, and they were like,
they were trying to
make
freak
it
out.
say
And we were
that
like,
his liver wasn't working.
no,
And I was like,
yeah.
there are literally two things
Yeah.
that are against
Yeah,
him right
yeah,
now to
he
have a
has-
higher bilirubin.
Yeah, exactly right.
He's fine. And
Yeah.
they were going to make us stay extra days. And I was like, I'm
Yeah.
going home.
But the ultraviolet radiation actually breaks down the bilirubin byproducts in the skin. And that's why they'll put them under UV light. But you can 100% just take them out in the sun.
You can.
Mm-hmm.
They say indirect sunlight.
No. If you want the jaundice to go away quicker, get them out in the sunlight. They are humans.
I think they say that they don't want people burning their
Well,
newborn
yeah,
babies,
don't
so
leave your
they
baby in
just
the
say-
scalding sun for an hour. Don't do that. Yeah.
But honestly, the main thing is to get it out of their body by feeding them
Mm.
and making the poops,
Yep,
the
yep.
billy poops.
Get
So that's what's
get
gonna-
Joni. See that
Where's
one?
Joni?
Right down. Yeah, right there.
Here,
Yeah.
your thoughts on consuming diatomaceous earth or other sources you can recommend for silica to help improve pain from severe osteoarthritis. I'm 72, 2-year carnivore, type 2 diabetic, and I need 2 canes to walk.
Yeah. So if you've been carnivore for 2 years and you're still a type 2 diabetic, then we probably need to talk about how you're doing carnivore. You should have a normal A1C now.
Maybe
I
she
haven't.
means history of type
Maybe,
2.
maybe. I hope so. I have not read any meaningful research that makes me think that the silica or anything else in the diatomaceous earth is going to help improve your arthritis. One thing diatomaceous earth is definitely going to be good for is if you have worms, parasites, the diatomaceous earth, always use food grade. Okay. You can buy it that's not food grade, but it will actually kill the parasites if you have those. But I don't know of, I'll look into that, but I don't think that ever makes it to your joints in any meaningful way.
Marilyn. Hey, Miss Marilyn. Thank you so much. Ashley says cervical effacement is what really matters, right? No, really, none of it matters.
None of it matters. Yeah.
What matters is consistent contractions with increasing severity causing the cervix to change. Now, whether that means
It's the rate of
thinning
change.
out or opening up, it's that matters. If
Yeah.
your cervix is continuing to open and thin, you are in active labor.
Yeah.
But you could be 5 and completely effaced
100%.
and still not be in labor.
That's right.
So it is not really your cervical dilatation. It is the progression
Yeah.
and how fast that is happening.
The only way to know for sure that the baby's coming is if the baby's head is sticking out of your vagina.
That's not true.
Then
If you're
you know
having
the baby's
contractions
coming.
that you cannot talk through and your waters have broken, that is most likely active labor.
Yep.
But you're going to be triaged. I did this for a living. Okay, that's why I know this. You're going to be triaged. We're going to keep you for an hour. I'm going to check you when you get there, and I'm going to check you in an hour. If you have made change and you have showed progressing contractions and you cannot laugh and giggle and play on your cell phone, then I will admit you. And that's how we make that decision. Marion, thank you so much. I've only had one girl who was laughing, giggling, and still progressed, and I kept her. But she was like 19 and just probably didn't know any better to be. She was just having fun, and she was on her phone. I was like, this girl ain't in labor. She was. That very rarely happens, though. Brittany says my water broke at 36 and 6, 31 and 4, and 35 weeks. My body doesn't hold babies long. Wow, that's awesome. My water broke. They told me, well, that's probably not going to happen this time.
We'll see.
I just feel like if it happened to the other time, it will happen this time too. I wanted to tell her, did you see my face? You knew I was going to be like, can you send me that study where it says that women whose water broke the first time won't break the second time? Because she was like, that almost never happens 2 times in a row. I was like, I feel like you made that up.
Yeah. I think
like you made that
I
up.
think our midwives, I think they kind of know
They
who we
hate
are
us.
and what we do. And so you can just watch them measuring every word before they say it because they know we're sitting there like, What'd you say? Say that again. Speaking to the microphone. So,
Is there a benefit to let pregnancy go beyond 40 weeks? There's no benefit, but there's no downside either. If baby is still trucking right along, good movement, placenta, like a good strip, which means the heart rate is having X cells, the baby's reactive, there's no reason to not go over 40 weeks. In fact, most women do go over 40 weeks, especially with first babies. And it doesn't mean a thing because the due dates are not really a thing. It's more like a due window.
Yeah. A good doctor doesn't even get concerned until a woman is 42 weeks.
Yeah.
Then that's still not bad. They just start to watch more closely, monitor more closely.
K5555. Hey, Dr. Barry Neisha, what's your opinion on stem cell therapy? 300 MSC intravenous infusion via umbilical cord donors.
Depends on what you're trying to treat with that. Stem cells, I feel like, are going to be a huge deal in medicine in the near and distant future. There's still some questions that need to be answered about it. But I think like doing stem cell injections into injured joints, into arthritic joints, I think that's excellent for helping those joints rejuvenate and heal. There may be many other ways we can use stem cells, but currently a lot of the research has been held up because instead of the researchers just getting the stem cells from cord blood, literally in every cord that gets thrown away after a birth, there's thousands of stem cells that they could use to experiment on, and nobody would have a problem with that. But they insist on getting the stem cells from aborted fetuses. And of course, about 50% of people in the United States have a big problem with that. And so they don't get much research funding as much as they would otherwise. But if they just get the stem cells from the cord blood, nobody would care because we're going to throw it away anyway.
Where'd you get your necklace, Neisha? This was a gift. It's Bonnie's birthstone. Thank God she made it to July.
About 2 days ago, she was like, what if she comes in June?
Because he bought me a ring and a necklace and earrings, all ruby. I was like, she would come in June, and then all this would just be random ruby jewelry. All right. Sheila wants to know, can I eat too much protein and cause my glucose levels to rise?
Not if you're eating very low carb, Sheila. That's virtually impossible.
Are you going to do a home birth, Neisha? Absolutely not.
I mean, not on purpose.
Not on purpose.
Yeah.
I think that home births are wonderful if you feel confident and you are comfortable and there is a hospital nearby and you're well prepared, And I'd be more likely to do a home birth on third baby, fourth baby, even second baby. I would not do it.
Oh, you're already thinking ahead.
I'm saying if, and that is not happening.
I heard. We all heard what you said.
Shut your mouth. No more babies. I'm just saying I would be more likely to consider that. However, I live in the middle of the boonies. There is not a hospital within an hour. If there was a medical emergency, which is the only reason I would need to be transferred from a home birth. Seconds count, minutes count at that point, and I'm not comfortable with that. So that is why. Are you doing delayed cord clamping? Yes, absolutely. We did that with Beckett as well. So much research to back that. There's just no reason not to. There's really no reason not to. Another thing we did with Beckett that Bonnie will also have is no bath for a week.
Yes, I think that's actually very important, especially if you've had a previous baby who had eczema or any kind of skin condition. Don't let the nurses scrub that baby down. That stuff needs to stay on your baby.
Doesn't mean you can't wipe the blood off of
Yeah,
them.
you can wipe off the chunks in the blood.
No, when I was in labor and delivery, I would take that baby and she would get a scrubbing. Okay?
With what kind of soap did you guys use? Like Johnson's and Johnson?
Oh, yeah.
Baby, yeah.
Mm-hmm.
So basically, 99% of the beneficial bacteria be scrubbed off that baby. And then if they had a little reaction to one of the fragrances in the shampoo, then they don't have the good bacteria to back them up. Now they've got eczema, or now they've got a little rash, and now they got to go to the doctor, get some ointment.
That doesn't guarantee that that's going to happen.
That's right.
But there's no reason to wash that stuff off for a baby.
That's right.
It's actually very protective for them to have that. So unless your baby is just covered in chunks, okay,
yeah,
it's really unnecessary. And most of that stuff wipes off. You don't need soap and water, and you can rub it into there. It's like a natural lotion. It's totally fine. It doesn't stink. unless you have a meconium baby,
then
then you
to
need a
wash that
bath.
off.
Okay, they need a
Wash
bath.
that off.
Yeah, which means that they pooped inside of the uterus and they have poop on them. You're gonna know if that happened. They'll tell you, and that baby does need a bath. But usually that doesn't happen, so you don't really have to worry about it.
Yeah, Sonny, so many people feel like you do. She said, I wish I would have known these things when I had my babies. And I wish I'd known these things when my first kids were born. I didn't know these things. But now that we do know these, now that Sonny, that you know it and all you other guys know it, you can help future generations of your family, younger cousins who are pregnant, your daughter, your son who's got a baby coming. You can gently, politely say, now, I heard, because you don't want to nag, right?
She might have commented something else up here. Okay. Late at night said, I'm feeling so discouraged. I was told I need to do 2 rounds of IVF. Well, you may. However, you may not. You may have just been given that advice because your doctor's not as educated as they should be. So I want you to go look up Dr. Kiltz. Can you type that in the comments for me, please?
Yep.
Dr. Kiltz is a wonderful fertility specialist out of New York City. He has a clinic that he runs, and he is primarily carnivore based for his women. He sees a very high success rate with his practice doing this. So I want you to go take a look at him, listen to his videos. He's very active on Facebook and Instagram. He does lives all the time. You can ask him questions on there, and give carnivore a try. And give, depending on how old you are as well, that for me, that mattered. I wanted to just have a baby. I wanted to go ahead. So I went ahead and did IVF. And maybe I would have gotten pregnant naturally the first time if I'd given my body time, but I was not willing to bet that because your eggs, the quality goes down, the number of them goes down. I wasn't going to chance that. I was going to go ahead and cash in my chips, And by some miracle, I got pregnant again without IVF. But there's also a book called It Starts with the Egg, which is how to promote egg quality. So Dr. Kills is going to encourage you to go carnivore for egg quality and just to get your body in the best health, inflammation down, all that stuff. And then also there's a ton of supplements, CoQ10, vitamin D3, K2, like all these things that are in that book that are really great to take as well.
Yep. Somebody missed what we said about washing the baby. Michelle said, why not wash the baby? So the underlying concept is you don't want to do any intervention that's not proven to have a benefit. And indeed, I bet a lot of you guys remember a grandmother or a great-grandmother who would not take a bath all winter long. My folks, you didn't, they didn't take a bath all winter because if you got wet, you would get sick. And I'm not saying that's true. I'm just saying that it's been kind of ancestral knowledge in humans that you don't get a baby wet for no reason. And so 10,000 years ago when a baby was born, they didn't run the baby down to the spring branch and bathe the baby thoroughly. They just wiped the baby off, wrap the baby, put the baby skin to skin, and wrap the baby up. That's what they did. And so that anytime you mimic what we've been doing for millions of years, I think that unless there's medical research to prove it's bad, in which in this case there is none, then you need to do what our ancestors have always done.
Where did that go? Leighton said, I'm following him. I will get more into him. Have you ever seen AMH go up? Mine is 0.36 and I'm 31. So 31, that's a good age.
Mm-hmm.
So you're still on the back end of 35. Yep. That's good. I don't personally work with IVF clients. So I would ask Dr. Kiltz and see if he has seen that go up. So what that is that's the hormone that like stimulates the follicles. I would think that they would benefit, that would go up. I don't know why it wouldn't. I don't think that's something that's set in stone. I would say that probably would improve with everything else.
Yep. And a lot of times we get focused on one particular lab result or one particular marker. But what you have to understand is when you adopt a proper human diet full of fatty meat and eggs with the yolk, you're moving multiple markers in the right direction. And ultimately, you're increasing your odds of getting pregnant and having a successful pregnancy.
Sunny says, what about the vitamin K shot and whatever else they give them at birth now? So you can actually buy your own vitamin K shot that doesn't have the additives in it that most people are concerned. Most hospitals are completely fine with you bringing that if it is from a pharmacy that your midwife has approved or your doctor has approved. It'll come in a package and you'll bring it so they can scan it and get the codes and all the things. They have to have that stuff, the expiration date and that kind of stuff. They have to have that. You can't just bring in, a syringe of just some random fluid. It has to be in the appropriate packaging. There's also an oral solution that can be used. Again, you'd have to talk to your OB, have them order it and bring it to the hospital with you so that they're able to document that. So there are other options. So just know that. Erythromycin, it's just an ointment. I would say more than anything to delay having these things done for the baby's sake and for your sake and for breastfeeding. Like Beckett did not go to the warmer. He went to me and he stayed there for an hour and a half before they did anything to him whatsoever. And that I did my research. I can't find anything that really bothered me about erythromycin or vitamin K enough
I agree. Yeah.
to be like, I'm not doing that. You can decline erythromycin, the vitamin K shot, you can decline it, but it's a big deal. Like they're going to make you sign a whole bunch of stuff and tell you there's a risk, all that stuff. Okay.
Yep.
So just so you know, you can decline anything. It's your baby. But my main thing was, from the minute that baby is born, it's already traumatic, okay? It's been a long day for the baby. It's been a long day for you. That baby needs to come straight to mama, especially if you're going to breastfeed, without interruptions, without a stab, without anything obscuring their vision so that they can see the nipple. Like there's a lot of things that go into that first hour and a half. They call it the golden hour for a reason. So that's my main thing. Do your own research, make your own decisions.
And this is coming from a labor and delivery nurse. And so the background of this is the nurses, they have a checklist of stuff they have to do before they're done with that baby. And all the eye ointment, the vitamin K shot, all that, and then also the hepatitis B. They'll try their damnedest to give you the hepatitis B in the hospital. But none of that stuff has to be done right then. I think Neisha did it exactly right. She's like, yeah, we're going to do all that. But first, this baby's going to come to me for an hour or two.
We didn't
we're going
do
to bond.
hepatitis B.
Yeah. But and so we just told them we'll talk to our pediatrician about the hepatitis B. But how many times do they ask us about hepatitis B?
Hepatitis B, not that many times. They tried to get me to get him circumcised every 5 minutes.
Times. Yeah.
I was like, so I didn't, he is intact. We did not do that. He did not get a Hep B vaccine, but he did get vitamin K and erythromycin. But I did my research on all of that, and that's the decisions I made.
Yep.
What about a C-section? Actually, that's a great question. So same with C-section, and most hospitals will allow you to do immediate skin-to-skin as long as baby is not having respiratory difficulties.
Yeah, if they're stable.
And even then, if you'll say, okay, but I want him right back, don't do anything, just make sure he's breathing and his lungs are clear, and then I want him right back or her back, whatever. And that should be fine. And then if they have to take that baby, you send your husband with your baby. Yeah. He never left Beckett.
Every time Beckett had to leave our room, I went with him.
And then they even did some stuff in our room, and they were like, because they didn't know I was a nurse. There's a test where they stick their heel, and this is required. All babies have to have it. And
federal law.
They drop little drops of blood onto a piece of paper that gets sent off to test for genetic disorders and such. And I told her I wanted him to be in the room when she did that, and she was like, very uncomfortable, because it's not a pleasant test. Babies scream and cry, and
it hurts.
But I wanted to be able to breastfeed him immediately before he had that done and immediately after he had it done. And I was like, I know he's going to cry. I know what this is. I'm a labor and delivery nurse. Like, I know what you're going to do. It's fine. I expect him to cry. I don't expect you to be a magician and be able to do this without him crying, but do it in the room. So. Yeah.
And so here's why we did that, why I followed him everywhere he went, because remember, those nurses are busy. They got multiple patients. They got this checklist they got to check off. And so they took him out to give him whatever. And then the nurse is like, well, let's see, my shift, I might as well go ahead and give him that Hep B shot while he's here in the nursery and get that. And then I can check that off my list. And she forgot that we've told her 10 times we don't want that, but she's got 8 other mothers.
Listen, though, that should never, ever happen.
I agree,
you
but
have
it does.
to sign a consent form. And unless that nurse is just dumb, and I mean that in the nicest way possible, and she don't check that consent form,
I agree. But it happens.
That's a lawsuit.
Yep.
Okay.
100%.
It does happen. It's very, very, very rare.
Yep.
Okay.
We had a baby. Rare. We had a baby. I didn't do it, but it was on the other team when I was on my OBGYN rotation that got circumcised. And there was nothing signed. The parents had told multiple people, we do not want our son circumcised. And the team was post-call. They were tired. They just lined the babies up and circed them all. And I'm sure there was a lawsuit. I didn't ever hear what came from it, but 100%. Yeah, but you just get in the habit, just like any other job, whatever job you do, you get in the habit of just, I do this, and this. And you stop thinking. And that can happen to doctors and nurses too. I've seen it multiple times.
Yeah. And Beckett didn't go to the nursery.
Nope.
They took him for his, what did they take? You went with him.
Yeah, I remember he had that little spot on his liver.
They took him for an
and you had to have an ultrasound. And the tech did not, she's like, you don't have to go. I'm like, I know, but I'm going. Yeah. And so I stayed right with him the whole time. It was very awkward. She just kept looking at me like, I don't know why you're here. I'm like, well, because I don't want you to just go back to your habits and do something that we ask you not to do.
Listen, I love nurses. They're wonderful people.
It was as much for the nurse's protection as it was Beckett's. Because if one of those nurses had done something to him that she said, no, don't you do that, she would have put her hands on him.
They were already on. Somebody had done something wrong that day already because they took him for his bilirubin. They have to draw blood. They do a heel stick to draw blood. And listen, I know it's so hard to get blood out of a baby's heel. Okay. And we kept waiting for the results and waiting for the results. It was 4 hours later. And finally I threw a fit and I was like, I need to know what his bilirubin level is because we're going home. So I don't know. I think they had to pull straws on who was going to tell me that they did not know where his blood was.
Yeah, they lost his blood. I forgot about that. Yeah.
Not that it, because I thought, I said, did it coagulate? And she said, no, they lost the specimen. I was like, okay. I said, well, let me tell you right now. You get one more try, and then we're going home. Tonight. I went home at 11 p.m. that night. I was livid.
Yeah, Blue Dove, they gave her baby formula when she expressly told them, I want to breastfeed only. And the baby was crying. The nurse is going to stick a formula ball in his mouth.
Another thing that they do during circumcision. We're over an hour. That's okay. We're going to keep going. There's 1,000 people watching, so you must like what we're saying right now. So if you do decide to circumcise your baby, which do your own research. Like I researched it. There's no reason, no scientific. It's strictly a elective procedure that is for vanity reasons only. There's no health benefits to it. But do your own research, okay? And I'm not judging anybody. That's just what I chose not to. But just know, I've been a part of many, many circumcisions. It's not pleasant for the baby. It is not pleasant for the doctor. It is not pleasant for the nurse. They're strapped down. And to try to calm them down, we stick pacifiers in sugar water.
Yep.
And stick the sugar water passy in their mouth to give them a sensation of releases pleasure.
Endorphins. Yes.
So that they're not as stressed out from the circumcision. So that's something else that you can think about.
Yeah.
But just, do your own research. And I don't care what you do. It's your baby. Okay. Like I'm not judging anybody. And a lot of moms, it's done. What's done is done. If you do your own research, do not beat yourself. You don't know what you don't know till you know it.
That's right. That's right.
Katrina says, what do you think about NP thyroid being substituted for Armour when it contains mineral oil and was recently recalled?
Yeah. So if it's been recalled, then it's not at the pharmacy and you can't get it. So it doesn't matter. But NP thyroid is much better than levothyroxine or Synthroid. Armour, Nature, WP, NP, and then Canada, IRFA, they're all better than Synthroid or levothyroxine. They may not be perfect, but they're better.
Mamas who
Well,
are
there they are.
breastfeeding, wanting to breastfeed. I have a few books for you. This is Aname's Guide to Breastfeeding. You can find this on Amazon. Y'all, this is Bible. If you want to breastfeed, feel confident, and maybe you don't have the money to hire a lactation consultant, you're on a budget, like, understand. If you have the money, hire one. If you don't, buy this book. If you hired one, still buy this book. Like, this is such a wealth of information. Read it. There's all kinds of tips and tricks and rational thinking in here. Okay. There's so much bad information about breastfeeding that gets moms overwhelmed and stressed out and think they're starving their baby. They're not making enough milk. All these things that are going to mess with your head.
Which is a big deal.
Yes. That's a huge factor.
Yep.
You need to be confident in your body and confident in the fact that you have a knowledgeable source to go to when you have questions.
Yeah. I would recommend you read this book twice, but then also, what do you think about this ninja level advice? I would take this book with me to the hospital and I would leave it laying on the bedside table so that any nurse that walked in the room would see this name right here and go, oh, they're one of those families.
Yeah, well, there's just
and then they
many,
would really be on their toes.
There's too many people who don't even know who Anna Mae Gaskin is that work in labor and delivery. Believe me.
They should know.
Also, La Leche League, free.
Yes.
Totally free.
Totally free.
Use them. Follow their Instagram. Follow their Facebook. Do all the things. This is another awesome. This is about childbirth. If you're wanting to do natural labor, this is also a really good resource.
Yep.
So those are both. I will have all this linked in the description after this is over. But breastfeeding, I think, is going to have a boost because of the formula things. And so I'm very passionate about it. I just finished this, in case you didn't know. I am now certified lactation consultant. This was my book. This thing, honestly, if you can afford to buy this book too, because it is amazing information. Very passionate about breastfeeding. That doesn't mean that I think you're a bad mom if you don't, okay? I just want you to be confident and have the information that you need should you choose to breastfeed, which I think more and more moms are because of the way things are going with the formula. Some dude, did I tell you this? Some random guy walked up to me at Walmart.
Yeah.
I'm largely pregnant. It's obvious I'm pregnant. He was like, you better head over there and buy you some formula. And I was like, okay.
Okay, Bubba.
Thanks for the advice.
Thanks, Chester. Yeah.
I was like, ew, don't talk to me.
I just posted a link to Anna Mae's breastfeeding book in the chat.
Thank you.
That if you're even considering breastfeeding, you should read that book. If you have a younger relative, because the stress and the drama that gets put on moms is ridiculous. And one of the main ways to turn off milk supply is if a mom's stressed. If she's freaked out, if she's scared, if she's being bullied or domineered,
any kind of stress,
she's just going to shut it down. And so with that book, it gives her the power to know I'm perfectly capable of this. I don't have to listen to any bullshit from anybody, and take a breath and just calm down. And that helps with milk letdown so much.
Anders says farmers play soothing music for dairy cows to help them produce more milk.
Interesting.
Yeah, any kind of soothing thing. And if you're going to pump, same thing, soothing atmosphere. I say get a video of you and your baby or just the baby and watch that while you are pumping. You'd be surprised how much that helps produce the hormones that produce letdown and bring your milk in. It's all about the baby. It's all about peace and the baby.
Yeah. All of Bonnie Blue's brothers and sisters are very excited to meet her. We talk to them daily, and they're all excited. They can't wait for her to get here.
Yes, La Leche League. Absolutely. Probably the best resource out there, especially for anybody on a budget, because it's free.
Yep. Yeah, and if the formula shortages continue, I predict that we'll start to see both freelance and professional wet nurses start to make a comeback. There are breast milk donation centers, and you can actually get breast milk from there. but it's a long drawn out process, and the milk has been pasteurized and homogenized, which I don't think probably helps the nutritional value of it that much. But I don't be grossed out by the concept of a wet nurse, of a neighbor who's also breastfeeding that you buy breast milk from, or you trade chicken eggs for breast milk, or just say, hey, can I have your extra breast milk? Because even if you're having to bottle feed your baby, but every now and then you can give your baby a few ounces of breast milk, 100% do that. Yes.
Yeah, goat's milk is a great alternative too. Just make sure, it's good quality. If you have your own goat, way to go.
Heck yeah.
Good for you. Let's see. Let's take a few more questions. Please mention the book from yesterday. Which book, Sherry?
Which book, Sherry?
He mentioned it, or did I mention it? Is it this one? Expecting Better. Is this upside down? Yes. Expecting Better, Emily Oster. Great resource for anyone who's just wanting to learn.
I'll post a link in the chat.
But obviously, especially for expecting mamas, grandmamas, aunts, daddies. Ken read this too.
Mm-hmm. I listened to it. Yeah.
Whatever. The end of the world is just the beginning.
Expecting Better. Let me put Oster's book here. And then I'll post that one.
And then I have to take Lily to the vet. It's her checkup day. Are you ready to go to the vet? No. You're getting huge, though. I can't wait to see how much she is.
Can you still pick her up?
Weighing barely. I can barely pick her up.
She's
It's
gonna
a problem.
be a big dog.
I bet the last appointment she weighed, when I say 20 pounds, if she don't weigh 28, close to 30, I'll be shocked.
Yeah.
She eats all the time. If she gets hangry, I've never seen a dog get hangry before. Have you?
No.
If she wants food and I haven't given her any, she will just attack me, bark at me, go crazy until I put food in her bowl. She's insane.
Okay,
Every
Sherry.
new beginning comes from some other beginning's end.
Who sings that?
I know who I want to take me home.
Yeah.
3 Days Grace? No,
So in other words, they're broke up. It's okay.
I don't know. It's
Yeah.
from the 90s.
So if any of you guys are like, why are all these shortages? Why does GM have 95,000 brand new cars they built that they can't sell because there's not a chip in them? I just posted a link in the chat box about a book called The End of the World is Just the Beginning. And that will explain many of the things that you see news stories about that you're going, what? Why is that happening? That book will help you understand.
Semisonic.
Semisonic.
It's called Closing Time.
It's a great lyric.
One last call for alcohol.
Oh,
so
Facebook.
Finish your whiskey.
Get
or
Amanda's.
beer.
I didn't know that.
What?
Did you?
What?
Facebook has a page called
Human Milk for Human Babies. No, I didn't know
For
that.
your city, they give breast milk away. 100%.
Cool.
Yes.
Cool.
I love that. Human milk. Let me look that up right now.
Yeah, I wish Bonnie was coming today. I mean, she may. The day's not over. But as of today at 3:18 p.m., she's not coming.
So
little
each
baby.
state has their own Human Milk for Human Babies community, and the one in Tennessee has 13,000
Boom.
people
Hit that
following
like
it.
button.
So I'm going to like that, and I'm going to share a link, and then you just can go from there to whatever state you live in. That's awesome.
Promote the nourishment of babies and children around the world with human milk. Really cool. All right, guys. Thanks for hanging out with me and Dr. B. What day is it? What's today? Friday? Today's Friday.
Today is Friday.
We may see you Monday or we may not.
We may go live from the hospital.
We may. We're gonna try to record. Listen, we had good intentions last time, and that shit hit the fan, and that did not happen. Yeah. I think we got 2 clips of me in labor, and then we were like, forget it.
I get so in the moment, that
Well,
I don't
we have
even
a
think.
doula now.
Yeah, and so she's going to remind me. That's one of her jobs is to remind me to take pictures and video.
We wouldn't even have pictures of Beckett if the nurse hadn't been like, "Hey, get your phone out,
I was like,
Dad.
oh yeah, the
Dad,
phone, yeah.
Dad, where's your phone?"
Yep,
And we were like,
yep.
"Oh yeah."
Yep.
So last time with Beckett, I went into labor on Sunday. We missed Monday Night Live, and everybody was like,
Yep.
"Is she here? Is he here? Is he here?" So, anywho, well, if you follow me on Instagram, you will probably be the first to know. So if you don't already follow me, it's at Neisha Loves It on the IG. So come hang out with me over there.
Absolutely.
Woo,
And thank
I'm
you
making
guys
traction.
for hanging out with us today. We appreciate it.
Yeah, check out the resources in the description below, or just go to amazon.com/shop/
Yep.
Neisha Loves It. And I'm going to make a pregnancy essentials list, which is going to have books and all kinds of stuff over there.
And if you know a young mother or a young mother to be, click the share button right down there.
Send them my way.
And send them this link.
You look like Bonnie's coming sooner than later. God, I hope so.
I kind of agree. Yeah, I kind of think.
I've been saying that since I was 20.
Nisha's got that I'm done look.
I am DONE. Stick a fork in me done. Okay. Forky.
Yeah,
I'm done.
Forky. I'm trash.
We love you and we mean it.
That's right. See you later.
Bye.